The first expectation for any person is the recovery. All right. And second is try to avoid the surgery as long as possible or as much as possible. So when we want to avoid the surgery, certain conditions we are actually successful in that one, and in certain conditions when we try to do the surgery, example, I go for a reconstruction of the anterior cruciate ligament. That's a very common sport injury, and also the tendon tear or the muscle tear of the shoulder, example supraspinatus tear. So we'll be trying to be very minimalistic in the surgery, not to expose much. So we go for an arthroscopic repair of the ligament injury. So that time the natural healing or the natural uptake of the graft or the reconstructed part was conventional, it is very slower. When I have an example where I operated supraspinatus tendon with arthroscopic repair, that to a elderly female that is more than 65 years, and the tear was of more than 3 months, and she was unable to lift her shoulder at all, and we expected that she may not get well with her surgery, post surgery. Then what we did is we tried to do the surgery and we made her rest for around 3 weeks. The 3 weeks is the minimum time where the surgical tissues or the surgical injuries will heal off, the inflammation will come down. Then we started with NMR, nuclear magnetic resonance therapy, where the healing process of the damaged cells, damaged tissues, and the surgical repair site, everything were enhanced in such a way. At the end of 3rd week, the patient was very free with her surgical site. She was moving very nicely. Similarly, with the arthroscopic repair of the anterior cruciate ligament, even when we start the therapy after 3 weeks, for say around 7 days or 9 days, the downtime of that recovery was drastically reduced, and the person was on the field by end of 4th month. So usually we typically say after reconstruction of ACL, we no contact sports for at least 8 to 9 months. So after the introduction of NMR, the few of my sport guys, they are playing by end of 3rd or 4th month, they are back to their ground. So in this way, it's actually augmenting my all the surgical procedures in enhancing the healing, and mobility also is increasing very nicely.